as you shared, I work with ketamine and MDMA in my practice. But, what I'm going to present, I think, is relevant to work with, many non-ordinary states of consciousness and working with many other medicines and plant medicines um, and in the context of psychotherapy, but then as well in the context of ceremony and other recreational use. So but I'm kind of talking here from my experience as a psychotherapist. And just kind of thinking and about the integration, and that really the meaning of the word from Latin integrare that I really love is that the sentence of like, I make whole, I renew, I repair, I begin again. And that this kind of process of integration and healing is what we are doing as we and engaging in as we're thinking about integration process in working with psychedelic medicines. And really thinking about reintegrating, reassociating, kind of bringing in parts of ourselves that maybe have been left behind, or that we haven't been able to connect with for, maybe good reasons, that there haven't been resources, that the non-ordinary states of consciousness allow us to reconnect and reclaim these parts of ourselves. So it's almost like a weaving of wholeness again. And I just kind of, as I was thinking about this reintegration, I put down some quotes from my clients of, the possibility of working through the somatic processes to find parts of themselves. And I'll just read one of them. Just a client that I worked with recently with extensive history of trauma, and she suffered from anxiety, insomnia, and had really difficult time connecting with herself, and used alcohol, disordered eating. And as she was able to process and move through waves and waves of somatic discharge in series of sessions, she wrote to me, and she wrote in the letter, I'm able to see the little girl that I once was, and now she's in a safe space. I know she's protected now, and she knows that as well. She feels it, and I have noticed my desire to drink and overeat is gone. And so just kind of this as a potential, of working through the body. So I want to talk about the goals of integration, how I kind of think about the immediate, short-term, and long-term goals. But before talking about integration, I think there is this importance of thinking about integration already in the preparation. And earlier today, my colleague Eric Signecht talked about, the importance of preparation. And here I put down some really these practices when we think about our body. What are the areas that we can support that will help us as we are going into the journey, so that it's really the preparation that is, days and weeks or months even before the journeys, that can help us to get most out of the experience. And then, of course, these practices are so helpful in the integration process and supporting the ongoing maintenance of the gains of the work. And that as well, we can see the change in our self-care of our body, that then kind of goes towards relationship and our being with family and friends. And so that none of it has to be perfect, but those are always kind of areas to think about, visit, see how we are doing, and what can we maybe do differently. And so from this kind of preparation and integration, going into the goals of integration, and that, when I think about working with the body, working with somatic intervention and somatic processing, that we want to think about, kind of understanding what is happening in the body, and as well where we are in the process of the integration. And so in the sessions, or experiences, there is that immediate integration, the immediate, when we're coming down with the medicine or from the non-ordinary states of consciousness, and re-inhibiting the body. And Stan Grof, the probably all of you know, but who hasn't, he's one of the founders of transpersonal psychology, who has extensively worked with LSD in research and then developed a method of holotropic breathwork. And he talked about the possibility and the importance of really clearing the somatic feelings from the body in the end of the session. And he said that is something what is most often forgotten or not done by therapists who are working with psychedelic medicines, that in the end of the session, that really going through the body and seeing what is still unresolved. Are there any feelings, sensations that can be processed, released, and that the person can feel really clear in the body in the end of the session. And so that is something that we aim for. It's not always possible. And then, this integration and continue in the days, weeks, or months following the session. But as much as we can to put, attention to that, being able to clear through the body, and then, putting verbalization, kind of starting to talk about the experience. And then, this kind of the middle part of the integration is really the process of working with what came up in the session, kind of continuing the process of processing trauma, further insights, releasing, receiving, and grieving, maybe renegotiation of traumatic events. And that it is this important process of the work that some of that can happen in the session, but some of it has to happen over time, and that there are these different layers of integration that can happen. And then the longer term goals of integration is really how can we bring the insights, the changes into our everyday life, into the world, how we can see the shift in the relationships and our ability to be intimate with ourselves, with our partners, with the community. And as well, how do we cope with the changes as we can, through the experiences, we or the clients change how they feel about themselves, how they feel around the world, what are their values, and how does how the others respond to that. So that is kind of the practice of the long-term goal of psychedelic work. Sorry, my dog is dreaming, having some kind of process here.
Can I ask you a question, Veronika?
Yeah.
So what does enhanced self-monitoring look like? Are we talking meditation practice, anything else besides meditation that could really help?
Yeah, thanks, Laura. So I think about it in a way of that the medicines can really allow us to become in this more observing self, of being able to witness, of being able to come, to allow whatever wants to come, and allowing that to move through. And so then it is about bringing this more into the everyday life, that we can feel, if it's joy, if it's sadness, that we can really make space for that without hiding away and let it move through. And so it is, like a meditation, meditation practices, contemplative practices are, really wonderful way of this long-term practice and what can support the ability to do that. And so, when I work with ketamine, especially, it is, I think, such a great medicine that can support that, because the dissociative aspect of ketamine is almost like having this experience of the observing ego. All the experience is still there. We're fully, connected with the consciousness, but we are not identified completely with what is happening. And so, just having that experience, we see that clients oftentimes it's much easier and much more desirable to be able to meditate. It's something what has been difficult for them prior can do that. And it is important to follow up on that, to continue doing that in the practice.
Mm-hmm.
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 Yeah.
Yeah, I'd be so curious more about attachment repair too. I'm so like I'm not totally sure on what that means, attachment repair.
Hmm. Yeah, and so I think about it as well as a like a longer term goal of our work, and so that attachment is something that it's a natural way. As we are human beings, we're born in the body, we need each other, and so the early relationships with our caregivers are so important. And so when there are any disruptions, as the parents are not available, or maybe they're not safe, or maybe they're abusive, or later relationships we have, we can have these unpleasant experiences, we start to respond to that. And the way of responding could be that there can be anxiety, there can be fear, there can be mistrust, there can be ways of kind of pulling away, detaching, not being available for relationships. And so that the psychedelic medicines can bring up that inner healing intelligence, the innate capacity to heal, and bring these woundings up to the surface. And so that, especially in somatic work, there is this opportunity for the somatic, for the attachment repair. Because, when you think about, maybe a baby being born, there is not a lot of words. We cannot process it verbally, but there can be, felt sense of, fear and loneliness. And that we can work with that somatically, with touch, with body work in the session when that is available. And that the repair is possible by really being able to internalize this new different experience, and being able to have more compassion to oneself, and maybe to the people who were source of that attachment injury. And then being able to bring that into like insight, and continuing to work with that in the integration. So I think the long-term integration would be that there is this attachment repair that's possible, that will then change how we feel in relationships, especially intimate relationships. That's where most often attachment injuries come up. um, and so maybe
Okay.
we'll talk about it later as I go further, and kind of now moving to the body. And so I think we cannot leave out the body from, when we talk about therapy and healing and psychedelic work. And as being a somatic therapist, it's like, of course, everything happens in the body, but the reality is that in Western world, we are so, many people are so disconnected from their bodies. And that you have a lot of psychotherapists and psychologists who are really trained in different techniques that don't include the body. And so that we talk about somatic therapies, and working with somebody who works with the body. And I think it has to be really included and be this integral part of any type of psychotherapy, any type of psychedelic work. And because our experiences are stored in the body, we have one nervous system which is processing the experiences we have. And so the experiences stay almost like frozen sometimes in the nervous system when we talk about trauma, or just stored in the body. And there has been this study that probably many people are familiar with, but it's called the ACE study, where there is a what calls a questionnaire that's asking about adverse childhood experiences. And it would be connected to abuse, neglect, witnessing violence, substance abuse by parents. And they used it for a huge amount, I think 17,000 members in Kaiser, and found really a direct correlation with chronic illness, with mental health illness, substance abuse problems. And so that there is no way how we can deny this connection of experiences on our health, and that a lot of problems that are looked at as purely physical are really psychosomatic problems. And so then when we work in psychotherapy, and especially with psychedelics medicine, there is this opportunity to process and heal what is kind of stored in our body. And So I want to just a little bit go into the theory. I'll go very briefly and very basic. So there's been a huge change in kind of how we understand, the processing in the nervous system. Was through polyvagal theory. Stephen Porges introduced it, and he kind of introduced this part of it, the two nerves in the parasympathetic nervous system. And the sympathetic nervous system is the part of the autonomous nervous system that's responsible for the fight or flight response. So it's when, our nervous system kind of detects we are in danger, something is happening, this activation comes up. So we are more kind of ready to, protect ourselves, either to run away or to attack. And then if the other part of the nervous system is stimulated, the parasympathetic nervous system, there are two sides of it. So the front side is when actually we feel, calm and engaged and safe. And so kind of like when we started to talk, and I was just, kind of seeing all of you popping up on the screen, and I cannot see anybody, there was a little bit of activation, like, oh, like there are all these people that I don't see. And so just taking the moment to ground and to look around, and telling my nervous system nothing bad is happening, everything is great, and we are all here from these different places connecting, and my nervous system could kind of settle. And there was this engagement of the ventral vagal nerve, and this social engagement, and being able to connect and be more playful. The other side of the parasympathetic nervous system is the dorsal vagal nerve. And that one is responsible for the response of freeze and submit. And so that could be, when we think about the sympathetic, that's more like an anxiety, hypervigilance, inability to sleep, inability to kind of, concentrate. And then the freeze and submit, that's more kind of the shutting down. It's kind of feeling tired, feeling sleepy, feeling depressed, forgetting things. And so both of these branches are here to really help us. And so I'm just putting here this slide where, there is this kind of middle part described as the window of tolerance. And that's kind of where that social engagement, the ventral vagal nerve is engaged, and we are feeling, just pretty good. And when there is some of the threat that we notice, we're going out of the window, moving kind of up here into that sympathetic arousal. And so that would be the fight or flight. And so it could be like anxiety, fear, anger, rage. And on top of here would be panic. And, the other side, and actually I'm going to kind of explain in a second how it actually looks, but this is kind of, really useful to like have it, drawn out to see, is the hypoarousal. So when, something is, triggering the parasympathetic nervous system, we go to feeling tired, to feel, the disconnection, avoidance, isolation, and depression and dissociation. And, this is kind of how it was, drawn and described for many years. But actually how it looks like, what a polyvagal theory has, kind of introduced, is that this hypoarousal and the dissociation are actually up here. So like you would take these two and you would move it up here. And so what that means is that the parasympathetic nervous system is actually the highest level of activation. So when our nervous system goes to the fight or flight, and then it makes the decision that we no longer can protect ourselves by that, it starts to shut down. So it goes to that, depression and shutting down, because the fight or flight is like we cannot use, or is not effective. And why I think it's as well important to just have this understanding is that when somebody is depressed, when somebody has been feeling kind of disconnected, when they start to work with those feelings, and and it can be in therapy, but oftentimes with the help of the psychedelic medicine, they have to come back to the window through the same way they went up. So that there might be really fast going through the sympathetic activation, and then they're in this parasympathetic state, And as they're coming out of the depression, they might experience a lot of anxiety, fear, insomnia. And so, we see that a lot when we work with ketamine, which specifically is, useful for working with depression, that people might say like, oh, I feel much worse. I cannot sleep. I'm anxious. But actually, if we're, really looking at it from understanding the nervous system, we can say, great, this is, you're really moving back into the window. We have to move through these states. And so I'm gonna
I have a question for you, Veronika.
yes.
Yeah. So can you give us like a more specific example of when we might see this? Like, let's say we're holding space for someone in a session and they go into hyper arousal and we're witnessing that. How would we work with them to come back into the window of tolerance and bring them back to the state? And then I'm understanding that the window of tolerance, that we have to go through the same pathway that they went there. So their trauma happened that way, and they have to come back through that same channel to come back to the window of tolerance. And how do we do that with people? And then what do we do when they're back in the window of tolerance?
Yeah. So I think I'll answer it in a little bit, because it's really, interesting to kind of understand what type of experience the person had, and understanding their history as much as we can, because what we're going to do is not always the same. But, the guiding principle in all work, as I think about it, is really trusting the inner healing intelligence, trusting that what is coming up for healing, and that our body has this innate capacity to heal and to complete what hasn't been completed. And so, when, like, I'll give an example of somebody who, maybe was attacked by an animal. So, something that I don't want to use something super triggering as an example, but thinking as an attack of an animal. And so, imagine there is a dog coming at you, and so you want to run away. So everything in your body is saying like, I have to run away right now. But then if you're going to start running, the dog is going to catch you, and it's going to be even worse than if you never, started running. So then the dog attacks you. Your body is in this arousal, wants to run away, but as well, there is this protective mechanism that's saying like, okay, like, don't run. So there is this like a freezing mechanism happening. And then, the owner comes, takes the dog, and, you're injured. You heal, and then you start to have this, post-traumatic stress disorder syndrome. So you're afraid of dogs, you hear a dog, some, kind of, you get this activation. And so then you have a session with the medicine, and this experience start to come up. And so in the body, it might come up like this hyper arousal, this feeling of that you wanted to run away, you wanted to fight a dog, but you couldn't do that in that moment. And so right there, you want to support the person as much as you can to be able to express whatever is coming up. So it's kind of a being able to somewhat hold a dual awareness of reassuring them that they're okay, they're allowing to come whatever's coming up, that you're there, and allowing that to happen, moving towards what's coming up. And so there might be kicking, they might be hitting, they might be biting, and so we want to support them to be safe, so that they don't hurt themselves, and allowing that to move through. And the oftentimes when that happens, then there will be a phase where there is as well, further release as shaking, crying, and that, then kind of coming back to, more kind of calm state, maybe we would say the kind of window of tolerance, where we will then, provide support, soothing, being able to, connect with the positive feelings. Of course, it doesn't always go as smoothly, because sometimes it can be scary for the person to move through that. They might not feel that support. So but that is kind of the basic idea, to be able to
Uh-huh.
support whatever's coming up, and so in the same way,
Mhm.
if yeah, go ahead.
Are you using words too? Like, are you reinforcing with words like this is a safe space? Like, I'm curious about like the verbal contribution that you're making in those moments.
Yeah, definitely. So I say, like, you're safe, just allow to come that up, and even encouraging the process by really inviting as well vocalization, so like, is there any sound that comes with that? And sometimes they make us some kind of sound, so I will even support that by doing that with them. So if they it's like, maybe I'll go with them, almost like helping them to really connect with moving through that. And sometimes
Mhm.
there is the fear, and so um it is helpful to be like saying something encouraging, like, you're safe, I'm here with you, allowing that to come up. So
Mhm.
that would be a way of supporting the person verbally and somatically to move through that. Sometimes we will use um, like somebody might want to push something or someone away, and so we might use, I will use my hands for them to push against me. And we talk about that extensively in the consent process, in the preparation. And it is really important, and the person, if we use touch, understands why are we using it in that time, that they don't feel intruded on, violated in any way by us coming into the space. So there is a consent, there is agreement in advance that we're going to do that. And and sometimes, like, in a when we talked before about attachment trauma, so when there is something really early trauma that comes on, the person might not be able to ask for what they need. And so then it's our experience of maybe trying, like, putting our hand on their back, for example. And then oftentimes we will see from how they respond if that is supportive of, or if it's not. um
Mhm.
so
There's a great question for you here by Harvey Andrew. Can I read it to you, Dr. Gold?
yeah.
Dissociation can protect against the child's fear of verbal, physical, or sexual abuse, or against the sadness of emotional neglect, abandonment. Would you expect healing of dissociation to produce flight or the feeling of the fear or sadness that was intolerable, overwhelming in childhood? Great question.
Yeah, thank you. Absolutely. And so all of these, fight, flight, freeze, submit, dissociation, those, we look at it in very non-pathologizing way, because those are strategies that helped the person to survive. That was like what helped them to get where they are today. And so there is always this process of permission, and coming to that, and slowly, kind of like almost like moving in and out with the process. um and there is that inner healing intelligence that's like bringing up what is possible to integrate and come. But as there is less dissociation, absolutely there is more feelings that will come up. So it's in the same way as the dissociation will be up here, so then there it's coming through the depression, through the anxieties, through the fear. And that is the integration process of providing the support to be able to integrate those feelings, to process those feelings, to allow that grief. um, and that it can really be a long-term process. hmm
Mhm.
so um, so I'm gonna looking at this. Okay. So this is kind of what I just talked about, that there is this tendency to complete, to heal. And so it's really, we want to follow the body, because the body knows what needed to happen, what didn't happen. And so maybe even like when we talk about a dissociation, it's like allowing the person to go into this dissociative state, because the dissociation, it provides that safety, and then coming out, and maybe then there is this energy, and and sometimes it can be like pain in the shoulder. And so we want to explore that by breathing into that pain, connecting with that, and being curious, is there something what wants to happen? And sometimes it's a movement, sometimes it's a protection, sometimes it's pushing, so that we want to come in to support the completion of the process that is kind of brought up by the inner healer, the inner healing intelligence. So this, I'm not going to go through, all of these, but just really showing that there is different types of trauma that happens, and then there is a different process what happens in the body, in the terms of fight or flight, and that the healing or processing of that will look differently. So I gave an example of the animal attack here, that, for example, here with the accidents, that might be more, straightforward of like, we're maybe, just simple as like playing, with a kid, and then the other kid throws a ball. We don't know about it. Suddenly from the corner of my eye, I see the ball coming, but I don't have time to catch it, and it hits me. Right. So there is this unfinished motor movement of catching the ball that I never did. And so that is something what then can come up and what needs to complete in that situation, so that it's like really fast, right? It's like a noticing something happening, and there is the impact. The global high activation, experiences are something that, I work with a lot, and I'll talk about a couple of them, but it is that something's, happening that's, so overwhelming or is so early, there's not enough resources that the whole nervous system is kind of activated together, so that fight or flight, freeze is happening. And so people who experience those kind of traumatic events, they might have difficult time with just sensory overwhelm, if it's smell, sounds, and that small activation or any type of activation can really activate the whole system. So there is more support needed in a way to be able to kind of separate what is actually happening, to be able to move through the healing process. And so one that I really, like talking about and working with is really healing the perinatal experiences. And that's something what Stanislav Grof, introduced. And he described these 4 perinatal matrices. And, we see that with working with ketamine so much. And it, sometimes it is important to talk about it with the client, but sometimes it's, just really about being with the experience and moving through that. But it's kind of interesting to have that context, and that, I put here the 4 phases of the birth process, and that each of them, kind of feel differently in the body. That so kind of the first phase is being, in the womb. That can be good, or it can be, challenging if, for example, there is a drug use, if there is stress the mother had, but as well it could be really like kind of that cosmic unity consciousness, kind of flowy feeling. And then when the labor starts and the cervix still is not open, there is a lot of pressure. So there can be, just feeling trapped, being in small places, being, there is no way out, really feelings of depression and hopelessness. And then, and oftentimes babies who are born by cesarean is kind of where they then come out, that they don't have this experience of the third perinatal matrix that is kind of that fight, being able to move through. So there can be a lot of kind of, we can see it as like giving up, trying to fight, but then, kind of letting go, because then, the cesarean happened. And so then again, this kind of, when the baby starts to move through the birth canal, the experiences in the psychedelic experience can be like a lot of, intensity, pressure, explosions, and then kind of the fourth matrix is the birth.
So Veronika, I just want to let you know we have, I think, 15 minutes left. So I just want to give you a quick little heads up on time. And if people want to stick around, there is a link that you can continue the conversation with. Do you like to go by Dr. Gold? Is that your preferred?
I'm not a
or
doctor, so
Veronika? Okay,
Veronika
you're not
is
a doctor.
perfect. Yeah,
Okay.
I'm a licensed
Okay,
American family therapist and a psychologist.
okay, great. Someone mentioned Dr. Gold in the thing, and I was like, oh, I didn't address you in that way. So we can keep the conversation going, but we're going to have 15 minutes more here. And I have a couple of questions from the audience that I've been tracking. And when you're done, we'll get into a couple of those.
Okay, so let me just see what I have more here. So I had okay, so I'll just go to this, and then I just had here talked about like a drowning memory, which is another way of really seeing the different phases of what happens in that experience. But maybe we'll talk about it later. So so these are some of the somatic processes in the session that we can see that I talked about, that are in the psychedelic session, and then they as well continue into the integration. So if the process is not completed in the body, or for example the trauma starts to open up and process, we will we can continue in working with the body and in somatic therapy in the days and weeks after. If somebody has this experience and is not in therapy, there are practices that people can do to support their integration, without a coach or without a therapist. And so some of the ones I kind of adapted here from Françoise Borzad's book, the consciousness medicine, around, when there is this stuck tension or pain, that there might be a way of like working more intensively with those feelings. And and then if there is actually like release of that in the session, or if there is like coming out of the free states, there is more gentle ways of working with the body, so that we have these ways of really re-inhabiting the body, becoming more alive, and using these practices to support the integration process. So here I kind of think that one force of the really trauma integration is the restoration of the natural responses, so that this fight, flight, or freeze are really life-saving natural processes that happen, and that we're lucky to be able to have. And so when the frozen and kind of stuck unprocessed trauma is released, we can come back to this organic intelligence. So when you ask, like, that's what the organic intelligence teachings are, is really comes from somatic experiencing. And it's like, how do we restore this organic intelligence of the body, that our body can process and release experiences that we will all encounter, because we will all encounter traumatic events. And then here, those are kind of other aspects of trauma healing. So it does happen in the body, but then there is this psychological process that as human beings we need to go through, that is different from animals who might process really in the body, and they don't go into these other processes as we do in the healing of trauma. And so this I just like to kind of end with this and a quote, so that integration's going well when we are not chasing the journey, not forgetting the insights, not running away from the challenging material, not throwing away the lessons or revelations of the journey, and living the insights in the real life. And then ending with this quote that I think is really bringing back to the community, that it is the task of those having received personal illumination, regardless of the mystical past, to return to the world so all may benefit from the light bestowed. So there's my email. Anyone wants to connect to me, and then I'll stop the sharing and see if there are any questions.
Okay, great. Thank you so much, Veronika. That was amazing. I love Françoise Borzad's work as well. You mentioned Françoise Center of Consciousness Medicine. I was privileged to interview her for the podcast, so we're going to have to get you on as well. Definitely setting that up. Okay, one question that I really loved. Someone said, how do we know if ketamine or MDMA assisted therapy is the right one for our clients?
Mm-hmm. Yeah, and it's such a great question. And I I think that once we'll be able to work with many more medicines, we'll learn as well, a lot what is, more suitable for a person. And ideally, in the ideal world, we'll be able to work with multiple medicines and work with combinations. And maybe somebody, it's appropriate to start with ketamine and then work with MDMA and work with psilocybin. Um, but, for working with trauma and PTSD, I do think that, MDMA is, wonderful medicine to work with, because it, this down regulates the amygdala, the one which, brings the fight or flight response. And that is similar when we work with the lower doses of ketamine. So the lower doses of ketamine is kind of this, brings up this empathogenic state. And to bring a little more complication there, for some people, the MDMA, especially in attachment trauma, can be triggering, because it brings up this like openness and these loving feelings. And so if there was, severe early attachment trauma, the MDMA could be trigger itself. And so maybe with someone like that, starting with low dose ketamine would allow the person to be this empathogenic state without being overwhelmed, and then maybe working with MDMA. So, it's kind of theoretical, but I think that are these possibilities.
Right. Another question I get all the time in emails, because, of the psychedelic leadership brand, I get so many people that always ask me all the time, what are some like recommendations for training programs without people having to necessarily go through like a 2-year transpersonal psychology degree, which is really, a certain level of like barrier to entry for people to step up and do this work. But I know a lot of people who want to do trainings in like, trauma informed trainings, essentially. Do you have any recommendations to make for people who want to step into the space and deepen their space holding capacities?
Yeah, so, I think some of the therapy, psychotherapy trainings that are available for non-licensed people can be just wonderfully compatible with psychedelic work. And so those are somatic therapies like Hakomi, somatic experiencing, organic intelligence. Internal family systems therapy is specifically for working with trauma and working with different parts that as well, people can enter into the training without being licensed. And we use that a lot. And some of them are longer term trainings. And it is, I have to say that I think there is a value in doing a long term
Mhm.
training that, when I went to Somatic Experiencing, the first weekend and the last weekend 3 years later has been, almost the same. And I heard it completely differently 3 years ago, because my nervous system has changed. Kind of how I was able to take that in has changed. So there is this, value in that. And there are a lot of new programs now being started in training in psychedelic assisted therapies. And there is a lot of opportunity, and as well a lot of challenges with, how do you choose a good training, how it is, offered by people who have worked with the medicines with clients. And I think it's so important to work themselves with the medicine, or, and there are a lot of trainings which are coming up almost like a business opportunities. And
Mhm.
and so how do we discern, how do we find a good training?
Mhm.
And um,
Mhm.
so there is the, for people who are licensed, there is the MAPS training. There is a we are offering the ketamine training at Polaris, Sage Institute,
Mhm.
the Pradi. So there are a few trainings that are being offered, but I think there is going
Mhm.
to be much more coming up
Yeah.
very soon.
What would you say is the main difference between Hakomi and somatic experiencing?
um I think there's a lot of similarities, but there are a little bit different concepts, how we think about the ways what people bring in, and how we um, kind of ask or inquire about the trauma.
Mhm.
And I think both of them are helpful. So, I did the first year of Hakomi training, and, really appreciated that, and really learned kind of tracking of another person together. Um, and I loved somatic experiencing and organic intelligence. And so, my teacher was Steve Hoskinson, who is teaching organic intelligence. So I kind of, my SE training was with him. And I felt, like I wished it was the first training I ever did, because I feel like working with the nervous system is really basic for any type of therapy, any type of work we are doing.
Mhm.
Yeah.
Mhm. Yeah. We're up to 84 attendees. Wow, what an amazing turnout from this amazing talk. There was someone had another comment. I had a John Yandel said, I had some very intense somatic experiences in my experience taking psychedelics at Soltara, which I think is the Soltara in Costa Rica. Good that it all came up. Working with a body worker and an integration therapist. Now, after 5 months, stuff is moving, but I have pain, fear, and shame several days a week. I'm willing to work as long as it takes. I've heard it could take a year or more. Any thoughts?
Yeah, thank you so much for sharing. And sounds like a really intensive process have, been brought up. And I'm, really glad you're working with these providers who are supporting you. And and I do think that integration can take really long time. Um, and that, it's really individual what way to go, how to work. But, you know, uh, when I worked, even without psychedelics, so with SE, I remember, we had this demo with Peter Levine, and uh, the person was very depressed, and Peter told him, I can help you with the depression, but you have to be willing to exchange it for anxiety, including insomnia, probably for 6 months or a year. And is that what you want to do? And that there was this understanding that sometimes really coming from some of the dissociation or depression, there can be a lot of this fear coming through. um, so I, just would really encourage you with patience and support. And sometimes it's as well not doing too much, that sometimes we like really want to get it through and do a lot of somatic work, and that sometimes it's really like slowing
Mhm.
down and bringing patience to the process.
Mhm. Thank you for that, Veronica. Yeah, I've been training with the Strozzi Institute. They do somatic coaching, and so I combine embodiment practices with microdosing, and I work mostly with leaders and entrepreneurs and CEOs. And I'm curious your thoughts on somatics and microdosing. Do you work with anyone? I know now more and more people have been asking me about microdosing ketamine, so it's interesting. Microdosing has really hit the mainstream on such a big level. What's your thoughts on that?
Yeah, I'd love to hear about yours. So my experience really has been focusing on the psycholytic medicine, where the medicine like lubricates the psychological process, and on the psychedelic, really the transpersonal
Mhm.
shamanic paradigm. And that's where, I think a lot of healing can happen. And so I absolutely think that there is healing and potential in microdosing, but and working together with somatic processes, absolutely. But I haven't, had those experiences with clients or myself
Mhm.
that I could talk about.
And just a couple more questions. We have a few more minutes. And then I'm also going to reread your bio because I didn't hit record at the beginning for your bio. So I want to make sure that people who are watching this get that full, incredible background on all that you've done and accomplished so far, because it's really amazing. I'm curious though about your take on working with like chemical compounds, and my understanding that ketamine can also be addictive, an addictive substance. What's your thought on that for people who are like either the question of like plant medicines versus, compounds like chemical compounds, or, also the understanding that ketamine can also have some addictive qualities? How do you respond to people about
Yeah,
that?
yeah. So I think there are like a lot of different medicines for a lot of different people, and that, um, I have to say that I fell in love with ketamine more and more as I've been working with it. And that in the beginning we thought it's the, one prescribable legally medicine that we can work with, but really wanting to work with other medicines. And even if other medicines are available, definitely I will continue working with ketamine. And um, as far as the addiction, there is a potential for addiction, especially in, recreational use. And the it's a psychological addiction that oftentimes is to the dissociative effect, to going away from one's experience. And so it all goes back to the set and setting, the intention, the way in which it is used. And so I approach working with ketamine the same way, like, I would work with a plant medicine, that it really in a ceremonial way, in uh, inviting this extraordinary experience. And
Mhm.
that was, the preparation, setting the ceremony, going into the experience and the integration process. And so we have not, seen with any of our clients really looking for ketamine outside of this treatment, that there is the way how they have created this relationship to this work of going deep within for their healing. And as well, ketamine is actually used for treatment of like a disordered use of substances. So it has been used
Mhm.
for alcohol use, cocaine use, and so there is this, but the potential is there. So if not
Right.
used with the right intention and right set and setting, there is a greater potential of misuse of it than maybe psilocybin or LSD. Mhm.
Uh-huh. Uh-huh. Someone asked about your slides being available. How can people get in touch with you?
Yeah, so as far as the slides, maybe I'll put them up on a slide share. So it's kind of a LinkedIn
Oh,
channel that if you look for Polaris Insight Center, so I wasn't planning to do it,
okay.
but I'll do it. I'll upload it there. And
Great.
yeah, and you can
This
email
is
me.
also being recorded. Oh, what's your email? Let's get that. Let's get that in the
Yeah,
chat too.
it's my name, Veronika with K at polarisinsight.com. So
Okay, you put that in the chat. I'm going to read your bio one more time. Also, I'll just say, if anyone wants to subscribe to the Psychedelic Leadership Podcast, I'm interviewing such a range of amazing people. If anyone's curious about the work that I'm doing, my website's livefreelaurad.com. And I'm going to end by thanking everyone who's attended, and also really big shout out, thank you, Mount Tam Integration, for inviting all of us onto this talk. And I want to read Veronika's bio one more time. And then Veronika, I'll pass the mic to you to leave on any closing thoughts or parting words. Okay. And also just want to say thank you so much to Anya. Like, look at this amazing artwork that was created. And thank you so much, Lauren, for being here, for interpreting. It's so nice to have that available for people. All right. So what a bio. Veronika Gold, a Czech Republic native, made SF Bay Area her home in 2013. She's been interested in the exploration of consciousness and the healing potential of psychedelics since her teenage years. She has an expertise in the treatment of trauma, as well as works with clients on preparation for and integration of psychedelic experiences. She's a co-founder of Polaris Insight Center, providing ketamine-assisted psychotherapy, and she is a sub-investigator therapist and a supervisor for MAPS, sponsored MDMA-assisted therapy clinical trials for the treatment of PTSD. Veronika as well serves as a consultant and facilitator in EMDR and organic intelligence training. Gosh, we didn't even touch on EMDR here, but that's a whole other topic I'd love to talk to you about. And Veronika has served as a trainer for Ketamine Training Center and currently provides training in ketamine-assisted therapy through Polaris Insight Training Program. Wow. Again, what a bio.
Yeah, thank you so much. Thank you, everyone who attended, and Danielle and Mount Temp. I'm, grateful to be here, and wonderful to be able to share. Thank you so much, everyone, and beautiful journeys and integrations.
Beautiful. There we go. Hi, Anya. And one more note, if people do want to keep the conversation going, if you go to the Mount Tam main website, I just got a message from Maggie. There is a link. There's a link on the website. It's a community hub tab. So if anyone wants to keep the conversation going, go to the community hub tab, and then you'll be able to keep this ongoing dialogue happening. And there's so many people already connecting here in the chat, like people from all over the world. We're all, in such a similar space. So if anyone wants to keep connecting, I know a lot of people put their Instagram handles in there. You have Veronika's email as well. You know how to get in touch with me primarily through the Psychedelic Leadership Podcast. And and I think that's a wrap. Good job. We're only 3 minutes over. We did it.
Thank you. Thank you so much.
All right. Aloha. Thank you, everyone. Have a good rest of your day.